I am Dr. Chandravarathi, Senior Consultant Dermatologist at Care Hospital, Banjara Hills. So many people do not, because whenever you go to a doctor, they suggest you a chemical peel. So most of you do not know what chemical peel is. Don't think it is, the name is chemical peel, we use a chemical to peel. Actually that word came like that, but actually it is fruit acid. It contains some acids. So that we use it. There are different types of chemical peels. There are alpha hydroxy acids, beta hydroxy acids. Like that, there are different types of chemical peels. So these are the acids. Actually, these are derived from grapes, derived from lemon, derived from sugarcane, derived from apple, or derived from grapes. So these are all concentrated acids. These have a property of peeling the skin. So that's why we tell that this is a chemical peeling. So chemical peeling, we use these acids to peel the superficial layers of the skin. There are some other acids which actually go deeper for deeper peels. So these acids are called trichloroacetic acid. So and phenol, these are the two deeper acids, we use it for deeper peels. So coming to the chemical peels, there are two varieties. One is superficial peels, another one is a medium depth peels, the third one is deep peels. In our country, we usually go up to medium depth, we never go to the deep peels, because for our Indian skin, we cannot do deep peels. And also there is a chance of scarring because of the deep peels. And not only that, in Indians, most of the time, we get hyperpigmentation because of the chemical peels. So most important thing also is, you should always get your chemical peels done by an experienced dermatologist, not by a technician or not by some beauty parlor. Chemical peels, when you are coming to chemical peels, what are the indications? Means when we use these chemical peels. Chemical peels, most of the time we use superficial or medium depth peels. Superficial peels means only the top layers of the skin, that is stratum corneum, and only the second layer we usually go up to. We don't go up to the dermis. The deeper layers are called dermis and subcutaneous fat. So most of the time the peels that we use is only for the top layers of the skin. So what are the superficial peels? These are all glycolic acid, salicylic acid, mandelic acid, acetic acid, lactic acid, like all these are superficial peels. And there are concentrations are also there, and starting from 10% to 70% to 100% concentrations we use them. And not only this, we also see to the pH of the peel. The pH is very low acidic, it goes deeper. The pH is high, you don't go deep. There's so many pluses and minuses, so many things are there. That is why most important thing is, it should be done only by the qualified dermatologist and experienced dermatologist, not by a technician or not by any beauty parlor, because you should know about what chemical or what acid you are using, and you should know the skin where you are putting it. The skin is also equally important, because if the skin is dry, if the skin there are some pimples and there are cuts and all those things, if you use a chemical peel, even though it is a superficial peel, it can go very deep and cause a lot of side effects. So this chemical peel should be done by a qualified dermatologist. Remember this. Please do not get it done by a beauty parlor person or by a technician. These are very, very important, because there are a lot of side effects can happen if you don't know the knowledge, if you don't have the knowledge of chemical peels. So you should have thorough knowledge about the chemical peels and thorough knowledge about the patient's skin. Patient's skin is equally important, because when you are applying it on the patient's skin, see also what type of skin it is, what type of peel you should apply. All these things are very, very important when you are applying a chemical peel. So what type of chemical peels usually for what indications usually we use is, for pigmentation, we use very superficial peels. For pimples, we use salicylic acid peels. And mandelic acid, salicylic acid, acetic acid, disorcinol, this type of peels usually we use it for pimples. Whereas for pigmentation and all that, a combination peels like glycolic acid, chlorosic acid, ferulic acid, these type of acids, are retinol peels. These are the things usually we use it for pigmentation, hyperpigmentation. So important point is you should know the composition of the chemical peel, you should know the pH of the chemical peel, and you should know the skin on which you are applying the chemical peel. So always, again and again I am telling, get a chemical peel done by a qualified dermatologist, not by any other person, because this is very important, otherwise they can cause lot of side effects. So chemical peels, when you are applying it, these are the indications, that is pigmentation, pimples, and then scars. Coming to the scars, we use medium depth chemical peels. We use different types of peels to go deeper, that is go up to the dermis. So like this, we go deeper. Even for the wrinkles also, there are deeper peels are present. So like lasers, even the chemical peels can be used. Most important thing is you should also know the side effects when you are doing the chemical peels. This is also very, very important. That is why I am stressing upon you always get it done by a dermatologist, not by anyone else. So what are the side effects commonly we come across is also very important. Most common side effect that we come across is hyperpigmentation. When we do for a pigmentary disorders, there is a chance of getting hyperpigmentation can happen because of this. Because our Indian skin will quickly produce pigmentation for any small things also. So that is why most important thing is hyperpigmentation is a side effect. So if it is a dermatologist is done, they know how to tackle the side effects of the chemical peels also. That's why I am again and again telling, when you are applying a chemical peel, always look at the skin. What type of skin you are applying? Is the skin is ready to apply the chemical peel or not? These are all very important factors when you are applying a chemical peel. Otherwise, this can lead to side effects. One is hyperpigmentation. Sometimes it can also cause burns. Sometimes it can also cause scarring, and scarring is irreversible. It cannot go back. So it's very, very, very important the chemical peel should be done only by the dermatologist. Okay, but beautiful indications with the chemical peels, we can bring down the skin to a beautiful level. Like we can remove the pigmentation, we can remove the acne, even including the scars and even the wrinkles. But should be very carefully done by an experienced dermatologist. So chemical peels overall, they are very, very useful for dermatologists to tackle these pigmentary problems, and also the scars, the pimples, and then these other things we can use it. So at the end of it, lastly, again and again, I am again insisting, chemical peels, they are very good, but should be done by a qualified dermatologist, because you should always think about the side effects when you are doing a chemical peel. So my advice to you all is, get them done by an experienced dermatologist.